This is ultrasound study of acute renal colic, severe pain, left lumbar region. This is the left kidney, and what we can see is that the proximal ureter is dilated, as are the calyces. This is the left kidney, all of this. This is the capsule. These are the calyces. These are the lower pole calyces. These are the middle pole, lower pole. So now you can see that there is fluid collection, which is urine. Now from here, this tube connects with the calyces, and this is the proximal ureter, in which you are seeing tiny particles. The proximal ureter measures 10.3 millimeters, whereas normal should not be more than 7 millimeters. So the proximal ureter is dilated, and this is the long axis view of the kidney. It measures 10.8, and this is the anterior-posterior diameter of the kidney, measures 5.3, and this is the ureter measuring 10.1 millimeters, and you can see that there are echoes within the dilated proximal ureter. Now the proximal ureter can be seen up to 5.3 centimeters, from where onwards the bowel gases intervene. One other thing is that in this view, you will see the dilation of all the calyces. The parenchyma is normal, because here you see the cortex, the pyramids, so corticomedullary distinction is intact. So this is the case of left obstructive uropathy, and when you have to measure the kidney, and the kidney is hydronephrosis, try to measure from the prone position. It will give you a better depth. Now in that view, previous view, we were getting the anterior-posterior diameter of more than 5, whereas from prone position we get the anterior-posterior diameter of the left kidney 4.8. Now 5.3 is more than expected normal, because 5 centimeter is the upper limit, 4.8 is normal. So while taking the anterior-posterior diameter, which is the main important diameter in case of kidneys as compared to the length of it, so take it from the prone position if possible. Now if you see, this is the urinary bladder, this is the urinary bladdery transfer section, this is the seminal vesicle, and don't confuse it with the any cystic area, and you will see with little maneuvering, you will see it becomes a longitudinal moustache shaped structure, which is the seminal vesicle. So this is the seminal vesicle. It relates with this part, and here you see, now this is the seminal vesicle, this is the seminal vesicle, these one and this one. Now when I move the probe capilloid, I see another cystic area, this one, which is separate from the seminal vesicle, and it contains here you see, you will see that it contains a small calculus, this calculus within it. This is the dilated distal ureter. 6.1 is the size of 6.1 millimeter is the size of the calculus, which is in the lower part of the dilated proximal ureter. Now from the other angle, this is not the right, this is the left, in fact, but I have moved the probe. This is the left distal ureter, and this is the calculus that is impacted. Now from here it will enter the urinary bladder. So this obstructive uropathy is due to a calculus in the dilated distal ureter. It's distal in its distal end, and this is the prostate gland. This is the seminal vesica. While moving, now you see this is seminal vesica. When I move the probe, this becomes the ureter in longitudinal section, and with a calculus of approximately 9.8 millimeters being impacted in it. So this is the cause of the gentleman's problem of obstructive uropathy that we saw initially. Here we are with the kidney again. So you see that the kidney is hydronephrosis and the proximal ureter is dilated. This is the proximal ureter, these are the calyces, and this is the kidney.